Today, let's explore the ethical landscape of cardiac care provision, a field where decisions are not just about medical treatments, but also about values, principles, and the well-being of patients. First and foremost, we must recognize the sacred trust placed in us by our patients. When individuals come to us seeking care for their hearts, they entrust us with their lives, their hopes, and their vulnerabilities. This trust forms the foundation of the patient-provider relationship and underpins all ethical considerations in cardiac care. In the realm of cardiac care, autonomy is paramount. Patients have the right to make informed decisions about their treatment options, based on a clear understanding of their condition, potential risks, and benefits. As healthcare providers, we must empower patients to actively participate in their care, respect their preferences, and support their autonomy, even when their choices may differ from our own recommendations. However, autonomy is not absolute. It must be balanced with beneficence, the principle of doing good and promoting the well-being of patients. In cardiac care, this means striving to provide the most effective treatments to improve cardiac health and prevent further complications. It also means considering the individual needs and circumstances of each patient, tailoring care plans to optimize outcomes and quality of life. But what happens when the principles of autonomy and beneficence come into conflict? This is where the ethical concept of non-maleficence, do no harm, comes into play. As healthcare providers, we must carefully weigh the potential risks and benefits of cardiac interventions, ensuring that the benefits outweigh the harms and that interventions are aligned with the best interests of the patient. Transparency and honesty are essential components of ethical cardiac care provision. Patients have the right to receive accurate and honest information about their condition, treatment options, and prognosis. This includes discussing potential risks and uncertainties associated with cardiac procedures, as well as alternative approaches or palliative care options when appropriate. Another critical ethical consideration in cardiac care is equity and justice. Access to cardiac care should not be determined by factors such as socioeconomic status, race, or geographic location. Healthcare providers must strive to promote equitable access to cardiac services, address disparities in healthcare delivery, and advocate for policies that ensure all patients receive the care they need, regardless of their background or circumstances. In essence, ethical considerations are woven into the fabric of cardiac care provision, guiding our decisions, actions, and interactions with patients. By upholding principles of autonomy, beneficence, non-maleficence, transparency, and equity, we can ensure that our cardiac care practices are grounded in integrity, compassion, and the highest standards of ethical conduct.